Today we are speaking about regenerative medicine with Dr. Nabil Kouka, the medical director of Salus Institute in Aventura, Florida, and a specialist in neuromusculoskeletal medicine.
I was a neurosurgeon and I then did over 3,000 spine surgeries. After I did that, I wasn't satisfied because every time I do surgery, the patient will get better. Then after 2-3 years, once the adhesions start developing, the patient will start having the same pain again as before the surgery. So I thought of looking for something that can replace the spine surgeries basically, or instead of doing the spine surgery, to do something else. And I started studying about stem cells. Stem cells I studied in New York and at Johns Hopkins in Maryland, and among the best professors that in the industry.
Around what time was that?
That was starting about the end of 2011, beginning of 2012.
And what were some of the first procedures that caught your attention?
The first procedure that I started doing actually was spine, of course, was lumbar spine in specific. And people were preparing for surgeries, and stem cell was their last alternative before having surgery to make sure that they get benefit without having the procedure itself, without having the surgery itself.
What were some of the first procedures and where did the cells come from?
The first procedure that I did was in lumbar area of the spine, where we infused some of the stem cell in the facet regions. Where the stem cell came from, it was very invasive. Either we take the stem cell from the blood or fat tissue or bone marrows of the same person that we infuse later on.
So in the past 6 years, what have some of the changes been? I mean, I know technology today, things change every minute. Obviously, stem cells have to go move forward, and we learn more every day. Where have you gone from the first autologous stem cells to what you're using today?
The adult stem cells from people 70 and 80 years old were not healthy enough to be used. 2 to 3 years ago, I started looking for other alternatives, and I found the stem cell that can be harvested from amniotic stem cells or amniotic membrane. Those are the ones that I decided to try, and I found it's a good results, much better results than the results earlier I had from the adult stem cells.
Why do you think you got a better result from the amniotic cells?
First, we have the amniotic membrane cells. They have much consistent rather than the adult stem cell or autologous stem cell. And also the technology now is becoming more and more precise to get us the membrane cells. It doesn't, amniotic membrane cells, it doesn't only have stem cells, it does have other factors that improve the production of growth factors. Even there is other anti-inflammatory elements. Also they have stem cell stimulator, because even the stem cell that you will harvest, they might die, but that's not the problem, because we have the stem cell stimulator material that will provoke the production of stem cell of that same person, and that's why we'll get much better results.
What are some of the benefits of the amniotic cells?
In addition to the stem cell, there is exosomes, and there is hyaluronic acid, there is growth factors, there is anti-inflammatory factors. So not relying only on the stem cell per se, but like how the amniotic cells can help in healing, let's say, the cartilage in a joint. When you inject the cartilage with the amniotic cell membrane, or amniotic membrane cells, you can find that there is exosomes that can communicate between cell to cell, and that helps the injection. You don't need even to have an ultrasound or X-ray techniques to precisely inject the amniotic membrane cells, because the amniotic membrane cells does have this cell-to-cell communication that can go find the problematic area and try to heal it by themselves. That's number one. Number two, the growth factors also helping in regenerating the area and get better results. I'm convinced now that the use of amniotic stem cells are much better and much effective because when we use the own or adult stem cells from the same person, we had to do it 3 times. Now, with the amniotic stem cell amniotic membrane cells, we use only 1 procedure. That will help, and the results are, as I mentioned, much better. It's better for the patient, it is cheaper for the patient. I'm convinced now, and I'm convincing my patients that this is the way how to proceed once there is a problem with the pain and any regenerative medical procedure.
About Dr. Kouka. Nabil Kouka, MD, DO, MBA, MPH, is a specialist in neuromusculoskeletal medicine and the medical director of Salis Neuromuscular Institute in Aventura, Florida. Dr. Kouka received his first Doctor of Medicine MD degree from Odessa Medical Institute in Odessa, Ukraine, and worked as a neurosurgeon for over 10 years in several countries, including Kuwait and Iraq during the First Gulf War, prior to his arrival to the U.S. In the United States, he received Doctor of Osteopathic Medicine DO degree from NYIT College of Osteopathic Medicine in New York, MBA degree from Monmouth University in New Jersey, and MPH degree from Johns Hopkins Bloomberg School of Public Health in Maryland. In addition to completing neurosurgical training in Penza, Russian Federation, and in Kiev, Ukraine, Dr. Kouka completed family and neuromusculoskeletal medicine residency at Larkin Hospital in South Miami, Florida. Dr. Kouka is board certified in family medicine and osteopathic manipulative treatment. He received certificate in minimally invasive spinal surgery, MISS, and certificate in environmental and occupational health from Johns Hopkins University. Dr. Kouka has published several articles, presentations, publications, and ebooks on neuroscience, traumatic brain injury, low back pain, and minimally invasive spine surgery. He was honored for achievements accomplished during the First Gulf War and received the 2010 Volunteer Physician and Surgeon to Haiti Award.